everyone. Welcome to my show, NainaMD, Fusion of Science and Beauty. And I bring you all the latest, greatest in technology, basically in terms of your health. We do have health technology now. And I wanted today, I have amazing guests. My first guest is Dr. Payam Hakimi, and he's a homeopathic doctor for almost 10 years. Body of Harmony is his center. Right here in Beverly Hills. You've done an amazing job. I love the place. And I wanted you to just kind of today get acquainted. I want the audience to get acquainted with allergies because, as you know, the traditional treatment with allergies has always been antihistamine, right? It's been Claritin or, and then maybe desensitization shots, a little bit of allergy testing. But will you explain to the audience today how you would do it and what success you've had using homeopathy and homeopathy and some of the other things that you've just learned about allergies with dealing with your clients.
Dr. Naina, thank you very much for having me on your show again. This is a great show. Thank you very much for putting this out there because we know there's a lot of information on integrative medicine and alternative medicine out there, and you're bringing it all together. Thank you so much. There's a lot of us get allergies, especially this time of the year as well. And the reasons are basically what comes into contact with our body. It can be what comes into contact with our skin, with our mucous membrane, or what we inhale, or what we actually take in and ingest. So all those go inside the body, and the body actually starts creating a reaction, just like the reaction that we'll have if we have a bacterial illness or a viral illness. Okay. So all of these things actually causes the body to have an immune-mediated reaction. So the immunity comes into play because of what it finds as foreign in our body. So it finds viruses and bacteria, some molds, or some of the things that we are allergic to as foreign substances, and as it does, it creates a reaction to it. That reaction can be the skin allergies that we have, it can be congestion of the sinus membranes, it can be
asthma, it could be asthma, right.
It can actually get even worse and become anaphylactic shock, and it can be closure of the throat and sort of not being able to breathe. So there's a big range of what an allergy can actually do to us and in our body. Absolutely.
I should know. I'm allergic to lobster. Severe anaphylactic reaction. So absolutely, I know what an allergy feels like. Yeah. And it's so. Tell me, traditionally, so there's different kind of allergies. But what I am really concerned about in getting the message to the audience is, they come and they're just saying, hey, I've got this rash that's just not going away, right? Or eczema. Or they'll complain of this sinus drainage that they just unexplained. And they're trying to take symptom relief, basically an antihistamine. And one of the things which I found so fascinating what you do is that you take the patient, but you actually figure out what it is. And then suddenly that patient has come back to me and said, you know what? All my symptoms are gone. So explain that.
So originally, or medically, the way we have been treating patients is they come in, they get an allergy testing sometimes, and sometimes they don't.
And that's skin. Let's clarify that even, right? That's a skin allergy testing, correct? There's different allergy testings.
There are different allergy testings.
I do allergy testing sometimes that is off the white blood cell. And there's a company that does that does so it's different kinds of allergy testing.
The different types, and they all give you different information, obviously.
Yes.
And traditionally, the way we treat this is, if you have skin allergies, obviously, dermatologist will give you something to put on the skin, which is usually in the form of steroid. If you have regular allergies, it's one of the antihistamines like Benadryl or one of the other ones. And then if it's severe allergy, we also go to giving patients steroids.
Yes.
But with integrative medicine and with alternative medicine, there is a different twist. First, we have to figure out where's the allergy coming from. So you're allergic to peanuts, you're allergic to mold.
And sometimes the traditional allergy testing may not pick it up, correct?
Right.
So that's why we go to, again, amazing laboratories that do a different kind of allergy testing, which gives us the answer right there.
So it's important to find laboratories that actually specialize in doing allergy testing, because they have machinery that can actually, or technology that can actually pick up better in our blood and what I do is actually we do stool culture. We figure out what's happening inside someone's body, because a lot of what we're allergic to is sometimes what we eat. And so
there's a sort of a gut connection to it,
there's a gut connection, and we've all heard of leaky gut syndrome. We've all heard of
inflammation of the gut. Just briefly, tell them what leaky gut is.
So the basic idea is, as we eat food or put whatever we put in our mouth, and it goes through the GI system, at times there might be breakdowns, either by not digesting it properly, or by having the undigested food sort of percolate inside the body before it's digested properly.
Yeah.
And that creates a reaction in the body, because those stuff is not supposed to be inside the body.
Basically, that's a larger protein. That food is looked as a larger molecule, and the body's not used to having these large molecules, because it's usually broken down with good digestion. So the body says, wait a minute, I'm just going to form an antibody to this. And some of the larger proteins are the wheat protein, correct? So people get wheat allergies or milk allergies. Protein. Yeah, that's how things happen. Yeah.
I have a lot of patients that actually are allergic to dairy, and one of the signs is having mucus congestion in the sinus cavities forever, and they wake up in the morning, they have the runny nose and the sneezing, and the whole time they're congested, and the only thing it is you take away the dairy, and most of their issues will go away.
But I'm just going to sidestep on something. Why is it that we don't look at even what the pills are containing? For example, I'm very detailed on everything. So I tend to for example, Claritin. Claritin, if you look at, or you look at a lot of the antihistamines, and you actually look at the binders are lactose binders on a lot of the medications. And if a person has, and we know that the person has dairy allergies, we know a lot of people have it. Why are we putting lactose binders? Can we not think of another binder, for goodness sake?
Right?
Right. So anyway, but so tell me a little bit about, then let's say once you discover the allergy, what is it that you actually do?
So once we discover the allergy, obviously number one is to take away the allergen,
right?
Because you don't want to create more allergic reaction.
Right.
The next step is to use homeopathy, or to use supplements, herbs, and try to balance out inflammation, oxidation, and allergies in our patients. And there's a lot of natural stuff that actually helps out with allergies. It can be as easy as having turmeric or curcumin, ginger, boswellia, rutin, quercetin, and even vitamin C itself is a very strong anti-inflammatory and anti-allergy. So once I figure out someone has allergies, what we do is we basically work on giving them everything that they need.
The nutritional support, basically, right?
The nutritional support.
Yeah.
The other part of it is to make sure that they digest their food properly, so that it's not causing the leaky gut syndrome that we talked about earlier.
So good gut healing regimen. So good gut healing regimen.
Good gut healing.
Yeah.
Making sure that someone actually has digestive enzymes. So I give my patients enzymes and whenever they have food, or bigger molecules like proteins, as we talked about, just to make sure they digest that food and that doesn't stay in their body, causing any allergic reaction.
Yeah.
We know of a lot of homeopathic medications that help out with allergies. There's actually one of the homeopathic...
I've experienced it. I remember you giving it to me when I needed it. It was great. It worked, by the way. It worked. Yeah.
One of the medications is Apis mellifica.
Yes.
Apis is the part of the honeybee that's used. And we know honeybee has histamine, it has dopamine, it has all these kinases that actually create the mast cell reaction. Mast cell reaction is what releases the histamine in our body, which is the hormone for allergies. We know that Apis mellifica, in studies, it's shown that it decreases the mast cell degranulation. So we know that it stops or slows down the allergic reaction. So that's one of the main homeopathic medications that I use with my patients who say, I get an allergic reaction as soon as I have, let's say, dairy, or I have seasonal allergies, or any symptoms that is related to mucous membrane congestion, or even any skin congestion that they might get, irritation or pain.
Have you seen, for example, just like skin allergies just go away when you just kind of balance just exactly what you're saying?
I had a patient that actually came to me after 2 years of being treated with steroids through his dermatologist, and I found his homeopathic type. I gave him his homeopathic type and a medication for skin allergies. And I didn't hear of him anymore. 2-3 months later, I was walking down the street, someone was tapping on my shoulder, and I turned around, and this guy pulled up his pants and said, "Doctor, look, After 2 weeks of taking your medications, completely gone. I don't need to take any steroids. I don't need to put any steroids or creams on anymore. And that helps a lot the body a lot, because we know putting steroids on the body basically weakens the collagen fibers, right?
Yeah.
It basically changes the color of the skin.
Yeah.
And
you know, and there's always a place for steroids. It's great for the acute thing when things are so out of control. But to chronically take something without really figuring out what's going on and trying to balance your body, I think that's what integrative medicine fills the void, don't you think? And that's why the whole purpose of this show is to bring doctors, amazing doctors like yourself. And you know, we have the best here in Beverly Hills. So how can they reach you?
They can, let me just say that I agree with you 100%, because a lot of our patients don't need the steroids or the antihistamines or any of these other stuff. It's very easy to manage these things with natural stuff and just staying away from things. Your patients, your audience can find me in Beverly Hills. My center is called Body of Harmony, and they can find us on the web, Facebook and Twitter account, Instagram on Body of Harmony. Or bodyofharmony.com.
Very good, very good. What are you, I think, you know, just the audience, if I could just ask you, what is one or two things you could just give for, let's say, someone who's suffering with allergies, at least to start thinking about? We're not treating them or anything, but just what would be just a tip that you could give?
So if you eat something, or if you're exposed to something and you see a reaction, that's an allergic reaction. Take that away completely from your life as much as you can. We know that digestive enzymes, probiotics help really.
Those are amazing, aren't they? Yep.
Just balancing out the GI system so that we don't carry the allergens in there. The other thing that I'm finding right now is people who have mold in their houses, and you know, they walk in. If you walk into your house or to your office and you have an allergic reaction, there's something going on. You need to figure out why you're getting this. The breathing in the air is bringing an allergic reaction. Why is that?
Well, you know, a lot of the mold is also found in everything that we're fermenting, foods and teas that we're fermenting.
I didn't know teas have mold as well.
Yes, a lot of the teas are also done by the fermentation process. So that's something for you guys to think about. So absolutely. So listen, I am so glad to have you back on my show, because we have amazing topics. I mean, every time you and I get together, it's like always another topic.
It's great. Yes.
It's great. And so I'm going to bring you back in the fall, because there's a topic I already have in mind that I would love to have you come back and speak about. But the other thing I wanted to tell you is that your Body of Harmony, I just want to ask you real quick, how did you think of the whole way you decorated the place? It's amazing. No, did you get an interior decorator, or was it all you?
No, there's definitely interior decorators are involved. I'm not that.
I had to ask because it was the color combination was amazing.
The color combination is mine, but we definitely had interior designers.
Tell the audience what the color combination you chose.
The color combination is a combination of mocha and almost an elephant, and then
it's amazing.
And
you brought a little bit of black,
white.
And you brought just a touch of black into it, yeah. It's just phenomenal. It's gorgeous. It's gorgeous.
Thank you. And I'm glad to be on your show, and thank you for all your knowledge and bringing all this information to the audience. We need more doctors like you that will actually put this word out there, and so that we can help our patients.
I think it is so important because more and more people are realizing that they need to find out the root cause. Okay? It's the people, it's you guys that are bringing the health revolution on. Really, seriously, it is a health revolution, because you want answers more than just acute care.
Right.
So this is NainaMD. I'm going to be right back with my next guest.